in, so I'm going to go first. First, I'd like to say what a great leader we have with our county manager. He has been accessible to us all weekend, so we really appreciate that. Because trust me, I kept him this poor guy. So the biggest thing that I would like for the commissioners as well as the citizens of the county to know is that we are continuing our preparation for what we anticipate to be a rapidly evolving incident. As of right now, Lenoir County does not have any cases that have been reported, so that's a good thing for us. We do have some counties surrounding us that have at least one case. There are a total of, as of 11 o'clock this morning, 33 cases reported in North Carolina with 0 deaths. So that's a good thing for North Carolina, and I'm glad to hear that. So as an emergency services department, we're continuing to work with our partner agencies, with the health department, the sheriff's office, UNC Lenoir, just to make sure that everybody is still on the same page. And we're within our office, we are preparing our staffing and our resources. We're ensuring that we have a contingency plan for staffing in case we have any staff that may become out of play because they may be exposed to someone that does test positive. So with EMS and as well as public health and the sheriff's office, DSS, we're constantly going in and out of people's homes. So that always does put our personnel at a greater risk than the general public. But we have plans in place. We have a policy that has come down to us, or protocols, that has come down to us from the North Carolina Office of Emergency Medical Services, and we're following that recommended protocol. So that protocol, what it does within the E911 Center, as everyone knows, our E911 Center is Emergency Medical Dispatch certified. So we ask specific medical questions and dispatch accordingly. So within this protocol, it actually provides us guidance on what questions we need to ask to the citizen. Based on answers that we receive to some of those questions, we may dispatch a call as a high risk. And that's just because they meet some of the criteria set forth in that protocol. So then when EMS responds to this high risk, when they get on scene, they'll assess the patient. If they determine that based on their assessment this patient is a high risk, then they don additional appropriate personal protective equipment as guidelined by this protocol. So people may see our EMS people in a little bit different attire as a result of this, but that's just for their safety as well as the safety of the patient that we're transporting in. Then we'll do a handoff to the hospital, and before I get ahead of myself, if we have a high-risk patient, we are not dispatching first responders. We're trying to minimize the risk of exposure. So it will just be our EMS personnel that will respond, and it'll be a case-by-case basis whether or not we have to send law enforcement with us, but at this time, it'll just be an initial EMS dispatch. So when we get to the hospital, we'll do a handoff to them, and again, trying to minimize the exposure to hospital staff and other patients that may be at the hospital. We've got a plan in place that will hopefully mean that those patients that we feel like are high risk won't go directly into the emergency department on the normal route. They'll go in via another route so that we're again minimizing that exposure to everybody. We're constantly monitoring the situation through the Center for Disease Control CDC website as well as the Department of Health and Human Services websites. We have conference calls. Samuel and I had a conference call this morning or this afternoon with North Carolina Emergency Management with our Eastern Branch office. So we just stay in constant contact. So we know that when we need to advance forward with something like a state of emergency, then we're prepared to do so. One thing I would like to get, and I'm sure that Pam will reiterate this, if anyone has questions, any of the citizens have questions regarding COVID-19, if I'm going to give a number that is a 24-hour, 7-day-a-week access number that was designed just for the coronavirus hotline. My personnel in the 911 Center don't have the answers to some of the questions that they're receiving in that 911 environment. So the number would be 866-462-3821. And I'm sure that Director Brown will also get on that as well. But overall, the Emergency Services Department, we're continuing our daily operation. We're still answering regular 911 calls. We're dispatching regular 911 for emergency and non-emergency calls to our EMS, law enforcement, fire department. So it's just business as usual, honestly.
Any questions for Jerri?
Good job.
Thank you.
Thank you, Jerri.
Well,